Thank you very much. So we're going to go straight to Matt Bonn next. Thank you very much for that very interesting analysis of the growing response to fentanyl. So I'm very delighted to introduce Matt Bonn. Matt's a long-standing drug user activist, a key member of the Canadian Association of People Who Use Drugs, and also one of the pioneers of drug consumption rooms from a community-led perspective, and one of our community heroes. Over to you, Matt.
Thanks, Matt, and thanks for a lovely introduction. And I'm going to be basing my presentation on some more community-led responses to the changing opioid crisis, particularly from a North American perspective. Some conflicts of interest. I have personal fees in AbbVie, grants, and Gilead, but it's all outside of this submitted work. I also always like to declare that I have injected and or smoked drugs and have most of my adult life, and that I've lost a lot of people very close to me during this North American opioid crisis. So where I come from in Canada is a place on the East Coast. It's in the unceded territory of the Mi'kmaq people. I'm based particularly in Kachuk. I have bad pronunciation. That's part of my East Coast accent, but that you know, we always have such a lovely working relationship with Indigenous people, and they really helped kind of foster a lot of the work that I do, and I know that a lot of my Canadian colleagues do as well. So here's just a kind of a snapshot of what I'm going to be talking about. I'm going to talk a little bit about the context of Canada's overdose crisis, the context of the United States overdose crisis, and some overlap between the two. Some older community-led responses that we're all very familiar with, but they're always important to highlight. Some newer community-led responses, what needs to be done, and some lessons learned. So what's going on in Canada? So since 2016, and it's actually when BC declared a public health emergency, we have had over 52,000 deaths across the country, and you know, those numbers are astronomical, especially for you know, I know it's more of a high income country, but it's not a large population country compared to the US or some other larger countries around the world. And with the hospitalizations, we kind of had just under that amount. We were around over 49,000 hospitalizations, over close to 200,000 emergency room department visits, over 244,000 emergency medical services responded to suspected overdoses. That'd be like, you know, your paramedics or EMS, and you know, also, you know, police are also respond to a lot of overdoses, also firefighters. About 3 of the 4 opioid-related deaths were among men. 74% of them involved deaths in 2020. 2024 involved fentanyl, so 2/3 of the opioid-related deaths were contributed to fentanyl. And most deaths occurred in British Columbia, Alberta, and Ontario, with high rates also in Manitoba and Yukon. And just a little context with our southern, I don't know what, our southern partners, or I don't know what to kind of call them right now, but so in 2023, they had 217 people die every day from an opioid-related overdose. That doesn't include stimulants, it doesn't include benzodiazepines, so that's around 79, close to 80,000 in 2023 from opioids only. You know, and I know a lot of the statistics are like it's more than suicides, car accidents, homicides put together by quite a large number. And just a couple things that are also kind of impacting both Canada and the U.S. We have a large, a lot of rising rates around infective endocarditis in North America, really kind of stemming from the unregulated drug supply. And I know most people here probably know what it is, but infective endocarditis is a preventable infection associated with the significant morbidity and mortality that has been rising in recent years in North America. And as I said, it has really been accelerated because of the toxic drug supply. So there's some graphic kind of images, and we know this is happening even more so in the U.S., more so than in the Canada context, but particularly in places like Boston, Philadelphia, New York. But a lot of these infections are, as I said, from the toxic drug supply, and it's from xylazine. And xylazine-associated wounds increase the risk of bacteremia, endocarditis, sepsis, limb amputation, and death. But I do think there's a lot of work that needs to be done around this, because if they are caught early, just like a lot of injection-related infections, they can be treated pretty effectively. But because of that internal stigma and that internal distrust with healthcare, it's really hard to, talk to somebody about some of those infections you may be experiencing. So what are some older community-led responses? First I have to really give a shout out to ACT UP. Community-led responses are for and by the community, and typically when the community is not taken seriously, directly related to a health or social issue. The first prime example of this would have been the HIV/AIDS crisis. Mainly men who have sex with men were impacted and dying at large rates, and really witnessing their community die, right? And without even a shred of empathy from the rest of the society. And I think the rest of society was completely unfazed by this until it started to affect them as well, right? And I think that's something we can really say for the drug using community too, right? Like, there's a lot of people that are not concerned if we die, but then, now it's such a widespread issue that everybody has been either indirectly or directly impacted by a drug overdose, or a non-fatal or not fatal or non-fatal. But really, there wouldn't be any community-led responses without advocacy from groups like ACT UP, who raised shit and refused to be silenced while their community members died. And people who use drugs, I like to say we borrowed this type of advocacy to create evidence-based harm reduction services. So this is back on the older community-led responses. This is just I'm bringing it back to the basics. Talking about mainline needle exchange is actually the first one in Atlantic Canada from where I'm from. They're based. They were they actually started an OAT clinic, O to the Needle and Syringe program, which would be very innovative today, but they did that back in the 90s, right? And Mainline is a program of the McMonday Friendship Center, and it's a peer-led organization, and they have a lot of amazing workers there that all have all different types of lived experience. And I think it's important to note that needle and syringe program doesn't just offer safer injecting equipment or safer smoking equipment, but they give people snacks, they do people's taxes, they do peer support, court support, they do a lot of referrals to health and social services. They have community barbecues, they really kind of ensure that the community is taken care of. Couldn't do this presentation without mentioning Insight, which was North America's first supervised consumption site, which started back in 2003. They're just such a wonderful organization ran by the Portland Hotel Society or Portland Hotel Society. But yeah, they've been operating. Now they do drug testing within a lot of these, within Insight. And they connect a lot of people for some of their safer supply programs through these sites. So we see these kind of older community-led responses really adapting to what needs to be done. Do these work? Yes. There's an abundance of peer-reviewed academic literature on all these older community-led responses, and I just want to highlight a couple newer community-led responses. So I'm going to highlight two. The first one I'm going to talk about is some wound care in Philadelphia. And there's a couple great organizations doing this. First one I really want to promote is the Savage Sisters, who is founded and ran by Cyril Laurel, who's a former substance user herself, but just a diehard harm reductionist. She really expanded this kind of support organization into more of a nonprofit that helped with housing, outreach, naloxone distribution, and this wound care, where they were seeing just such a desperate need for it. She's done a couple documentaries that went to winning Emmys. She was a recipient of several awards, including a Congressional Medal of Honor. And she actually developed a first-of-its-kind xylazine training, delivering both locally and nationally. So someone I have the utmost respect for. I got her to send me a quick little video, but it was too long, and I didn't want to take away from. You can Google some of her cool videos and check out what else Savage Sisters is doing. But this is kind of their philosophy. Our goal is to attack addiction ferociously with radical love through connection, which I think is a lovely quote. So their 2024 impact, they had. They reached almost 40,000 people. They gave out close to 14,000 naloxone kits, and that was within reaching, doing it throughout outreaches 2 or 3 times a day, right? About 721 outreaches. So, it's just amazing to see what a small nonprofit can do. But as I mentioned, they also do a lot of wound care clinic, bandages, dressing, giving people supplies, teaching them how to keep them sterile and bandage them themselves. Which I just think is such a desperate need in North America right now as well. The next organization I want to highlight is Prevention Point, and Prevention Point is a Philadelphia nonprofit public health organization, which actually started from it was founded by ACT UP Philadelphia, so kind of seeing that evolution of older community-led responses into some of these newer community-led responses. But they do, they also do provide needle and syringe programs, but they do a lot of wound care clinic as well. And, I was going over my presentation last night, and I just wanted to highlight, I'm somebody that has a lot of these infections. I use xylazine. I have some pretty horrific track marks, but the last piece I wrote in Filter was a piece on learning to love my track marks. My fiance that passed away earlier this year kind of really, I showed her my track marks as soon as I met her, and she's like, "What do you think? I'd never seen a track mark before?" And she just kind of really allowed me to start to be able to love them and not be ashamed of them as much. And I just think that's a wonderful thing when you meet somebody that can bring that out in you. I'm going to talk briefly about compassion clubs in Vancouver. It's just been amazing to see kind of the evolution of Dolphin, what's happened, but also sad. But I think it's been great, and Eugenia's partner, Dr. Thomas Kerr, has done a lot of work with them and been able to, put these studies through research ethics boards, and they published in a couple IJDP papers. But the first paper that they published was this enrollment in an unsanctioned compassion club, and it was found to be associated with reductions in any type of non-fatal overdoses and non-fatal overdoses involving naloxone administration, so just using oxygen and things like that. And I think, it's really cool when you can document these and get some of these into the evidence, even when it's highly illegal, and what they're doing was amazing. And, just the utmost respect for this crew. So I think it's really important to note that, the Dolph legal case is going on right now. They were arrested and charged on October 25th in 2023 when Vancouver police raided their compassion club. So, I think even though we're in Cape Town, we have to stand in solidarity with Dolph, and if we can donate just a little bit of this amount, they do such amazing work, and they did all kinds of fundraising from coast to coast in Canada, and either verdict, whatever is the end result of this case, is going to have an impact on drug policy forever, not just in North America, but around the world. And, I just, there's not too many people you can say that are willing to go to jail for this cause, and I think you just got to shout out, these are legends, okay? And let's just hope for the best in court. So what needs to be done? Everything still: legalization, regulation, decarceration, sustainable funding for all harm reduction services, prescribed alternatives, HIV/HCV elimination, real decrim, and it all can be done, right? But I do want to highlight a couple lessons learned, and I have 3 points that I'm going to end off on. And this one I feel may be a little controversial, but I feel like for harm reduction to be sustainable, it needs to be bipartisan. Conservatives may not care about the actual people, but they do care about their money, and they are going to care about some of these prevention methods. And I just think as long as you can if we want these things to be sustainable and not always be at risk of shutting down, based on every 4 years when there's a election, they have to be bipartisan. My second lesson learned is, and I've learned this one for myself, interventions, services, and programs are really only possible when there is funding attached to them. Hopefully with not a lot of reporting, hopefully very, like, yes, you do got to do some reporting, but there's so much evidence on these sites, but we still do need to look at sustainable funding options. And third one is, don't be afraid to take your battles up in court. I'm not recommending go to the U.S. Supreme Justice of, court for your first line of defense, but if you believe in what you're doing, and you just got to be willing to take those battles up in court. So I just want to acknowledge and kind of contribute this presentation to my partner who passed away on August 10th. So it's been very fresh. If you asked me a couple weeks ago if I'd be in Cape Town, I didn't know if I was going to be alive. So, it's been great. And she was actually a conservative Trump lover. So we had very different political views on these things, but even towards the end of it, she started to ask me about harm reduction and things like that. So it's always great to see, no matter who when you meet somebody, who they are, but how the impact you have on one another. Thank you.